Are you planning a trip to Thailand in the near future? Maybe you're thinking about coming here for a holiday or living here full-time as an expat, as many people each year choose to do. Well, if you are, and one of your concerns is, what if I get sick or if I get into some sort of unfortunate accident and I end up in the hospital and need to receive treatment by doctors here in Thailand? If this is something that concerns you and you want to know what Thailand hospitals are really like, then this video is for you. I'm going to be sharing our experience from visiting Thailand hospitals multiple times over the past 12 months. And I'm also going to share some comparative data of the healthcare system here in Thailand versus back home in Australia, as well as Canada and the United States. But before I do, if you find this video helpful at all, please hit the like button and remember to subscribe for more content just like this. Okay, so if you've been watching our channel, you would know that my wife Mandy and I have been living in Thailand on and off for the last 12 months, and we're having our first baby here in Thailand. Really any day now, actually, to be honest. So having said that, we visited our fair share of doctors and hospitals over the past 12 months, not only for pregnancy checkups, but I've been sick a couple of times and had to go to the hospital. I've been to the dentist here in Thailand, as well as received acupuncture and visited a chiropractor as well. If you've never been to Thailand and you've never been to a doctor or hospital here, then you would probably assume that the level of care is not as good as it might be in more developed countries. But you'll be pleasantly surprised to find out that the Thailand healthcare system is ranked one of the highest in Asia, and since 2016, it's actually been ranked 6th best in the world behind Denmark, Japan, South Korea, Russia, and Taiwan. Also, Thailand healthcare costs are roughly 1/5 of the price of healthcare costs in the United States on average. There are currently 370 private hospitals in Thailand with over 36,000 beds. In Thailand, the healthcare sector is split into 3 sections: government healthcare, private healthcare, and non-profit organizations. And Thailand is actually one of the main medical hotspots in Asia, with many people coming to Thailand specifically for medical tourism. And that's because not only can you receive a very good level of treatment, such as dental or cosmetic surgery, for example, but you also get to have a holiday while you're receiving treatment here in Thailand. So the private hospitals here in Thailand, I have to say, have excellent facilities and staff from our experience. We've been visiting the same private hospital for almost 9 months during Mandy's pregnancy, and everything from the parking situation, which is absolutely free, by the way, and when you park, there's actually a courtesy golf cart shuttle service that will take you from the car park to the main entrance of the hospital. And the facilities in the hospital are absolutely amazing. There's plenty of cafes and restaurants with great food options and also reasonable prices, and it really just doesn't feel like a stuffy hospital. Everybody greets you with a smile, and the nurses and staff are all extremely positive and helpful, and most of them can speak quite good English, which helps a lot too. But the private healthcare is run by private organizations and companies, and therefore you need to pay out of pocket for visiting a private hospital in most circumstances. Whereas public healthcare in Thailand is completely free for Thai citizens who have a universal health card. And it's also quite a bit cheaper for foreigners than visiting a private hospital as well. However, the government hospitals are often a lot busier and a bit more understaffed, which means that wait times are longer and the facilities aren't necessarily as nice as the facilities in private hospitals. But I have been told by some friends of mine that have visited the public hospitals here, the doctors and the nursing staff are all super competent and amazing, and are some of the same doctors and nurses that work in the private hospitals here. So aside from our experience being pretty much nothing but positive here in Thailand, I'll share some statistics so we can actually see how the healthcare system stacks up against other countries. So some statistics for waiting times for healthcare in Australia are as follows. For most public patient surgeries, it'll take about 40 days to get the surgery you're waiting for. 13.9% of people report waiting 3 months to see a specialist in Australia. 42% of people reported having no wait for primary care appointments. However, the other 58% report waiting between 3 to 6 days. And an emergency department visit wait time can vary between 10 minutes and 4 hours in Australia. Now, in the study done in a GP clinic in a tertiary hospital here in Thailand, the average wait times at each service station are as follows. Triage is 4 minutes, medical records 6 minutes, insurance 3 minutes, lab 7 minutes, x-ray 25 minutes, GP up to 93 minutes, and pharmacy 35 minutes. And you can expect to see a specialist and be admitted for surgery within just a few days at a private hospital in Thailand, as well as an appointment for a GP, usually on the same day. From our personal experience with both visiting the OBGYN for Mandy's pregnancy, as well as myself visiting the GP for a couple of times, we found that the wait times were very minimal. The only reason we've ever had to wait to see a doctor is because the doctor was called out for an emergency surgery or something like that. And it's important to note that visiting a private hospital here in Thailand wouldn't be as affordable for us if we didn't have a great health insurance coverage, which is why we've been covered by SafetyWing Nomad Insurance since we left Australia almost 3 years ago, which has been amazing for both health and travel insurance, covering us for everything from lost luggage to minor health scares. But since we decided a while ago that we did want to have a baby while we were living here in Thailand, we now not only have reliable travel insurance for when we're on the road, but we're also covered for all of our medical needs as digital nomads, including maternity, because we now have SafetyWing's Nomad Health coverage. So Nomad Health is a global health insurance for remote workers and nomads just like us. It's basically a fully fledged health insurance that covers your medical needs worldwide, including in your home country. So the way it works for maternity is there is a 10-month waiting period. So if you're on the fence or if you're thinking maybe you do want to have a baby overseas, for instance in Thailand, then we'd advise signing up as soon as possible. And while Nomad Health does include maternity cover, it's actually very handy for a lot of other things, including dental, optometry, screenings and vaccines, physiotherapy, and much, much more. Both Mandy and I are covered by Nomad Health, and I actually have used it to visit the dentist recently. I got some new glasses earlier in the year, and I've been doing some acupuncture and physiotherapy, and all of this has been possible because of SafetyWing Nomad Health. So if you're a digital nomad like us who's thinking about maybe having a baby overseas, or you just want a fully fledged health insurance, check out SafetyWing Nomad Health. We'll leave the link down below in the description. Okay, so moving on to Canada. All citizens in Canada and permanent residents are covered by the healthcare system, which is the same as Australia, while in the United States, studies suggest that 7% of US citizens do not have adequate health insurance, if any at all. One big complaint about both the US and Canadian systems is waiting times, whether for a specialist, surgery, or specialist treatment such as radiation for breast cancer. A 2021 survey found that 39% of Canadians waited 2 hours or more in the emergency room versus 31% in the United States. 43% waited 4 weeks or more to see a specialist versus 10% in the United States. And the same survey states that 37% of Canadians say it's difficult to access care after hours without going to the ER. 47% of Canadians and 50% of Americans who visited the ER over the last 2 years felt that they could have been treated at their normal place of care if they were able to get an appointment. In the United States, the average wait time for a first-time appointment is 24 days, which is 3 times faster than in Canada, and wait times for emergency room services average 24 minutes, which is 4 times faster than in Canada. Wait times for specialists average 3 to 6 weeks in the United States, which is 6 times faster than Canada. So it seems like even though public healthcare is free to citizens in Canada, the level of care is not as great as the United States in general. However, the United States has the issue of healthcare not being free to citizens and pretty much everybody needs health insurance in the United States, which is a stark contrast to Thailand. So I'm actually going to read a Reddit post that I found while researching this topic, and the post says, how does Thailand's medical system compare to other countries? So the first reply says, very good, especially compared to its GDP. All Thai citizens and foreigners working here get free public healthcare, and there are over 500,000 health volunteers across the country to provide treatment in the communities. That's why Thailand always ranks high in healthcare. And so the second comment I found was very interesting, which says, I'm from Canada. Thailand is significantly better. I've had no issues here finding specialists. Literally just walked in and I'm usually given an appointment that day or at worst later that week, which has been that same experience for us as well. Whereas back home in Canada, a referral takes months, and for some weird reason, people just accept that fact, even though we're grossly overtaxed. I got to agree with that. The next one says, I've thankfully not needed an ER room here in Thailand, but I know the wait times are much shorter than in Canada, even with the significantly larger population here. It's normal to wait 12 plus hours before you even get a bed in Canada, but for serious issues, I've never heard of anyone waiting that long here in Thailand. Yeah, and we've had one trip to the ER and we've only waited for about 10 minutes before Mandy was in a bed receiving treatment, and she was discharged within like 2 to 3 hours. And the total bill was, I think, around $100 and might have even been less than $100. And someone commented underneath that, I agree, I'm a Canadian here. I've used the emergency rooms at Pattaya Bangkok Hospital. I came in with a panic attack at 5 a.m, could not remember my name, could not sign anything, could not operate my phone. I stayed in the ER wing for a few hours after getting some medication and being hooked up to heart monitors. They wanted to release me, but I told them, no, I'm not going anywhere. I think something's wrong. I need to be admitted. Once they were sure I had insurance, they wheeled me to a private room and had a balcony, 55-inch TV, couch, table and fridge, and I stayed for 2 nights while they ran all their tests. Great service. This person then says, on another note, while in Bangkok a few years back, I rolled my ankle and was in severe pain. Nothing broken but tendons. I went to submit to the hospital and asked for cortisone shots for the pain, which was no problem. 3 months later, when the cortisone was wearing off, I was back in Canada. I went to the hospital for a shot with my Thai doctor's note and they would not do it. Instead, they gave me a compression sock. I wore it for about a day and walked in pain for 6 months. So there's my breakdown of Thailand's hospitals. As you can see, Thailand is an ideal destination for medical tourism and for long-term living. If your health is something you're concerned about, with high quality medical care, cost, effectiveness and lower cost of living, it's a great place for long stay patients. And the Thailand government has made a conceited effort to turn the country into the world's medical hub over the next decade, which I think it will become. So if you found this video helpful at all, please hit the like button and subscribe for more content just like this. And we will see you in the next one. Cheers.